Past 4 days, you've heard from patients, doctors, educators, and advocates about why inequity in healthcare is so harmful. But where do we go from here? How do we ensure that every person, no matter their gender, race, or ethnicity, receives quality care? A lot of it begins with examining our own biases. By now, it should be no secret.
Bias and racism is everywhere.
Even in healthcare.
You all right today?
Yes, sir.
All righty.
And that's coming from a doctor. After talking with Isaac Apole and Christopher Brown, two black doctors, I learned bias can cut both ways.
The cultural literacies that you have to overcome sometimes, the medical literacies you have to overcome sometimes, and when you don't look at it holistically, I think the overall patient care suffers.
I had my first black patient with cystic fibrosis, which is a white condition, and it was a mental mountain for me to climb to look at this dark-skinned young lady and accept that she has cystic fibrosis, because we've always been told that's a disease of white people.
You know, I've often been told and grew up thinking sickle cell is a disease that only impacts black people. After talking with these doctors, I learned it's a trait with origins dating back to Africa. It formed as the body's developed response to help fight malaria. You know, white people live in Africa too, so white Africans sometimes get sickle cell. How do we eliminate these biases on the front end so that we don't have more doctors who've been practicing for 10, 15, 20 years that still kind of spread this false narrative?
There is a lot of hope that these false narratives are going to be eliminated eventually. And this is coming from the younger physicians now in training. Resoundingly, our students have told us that we can no longer perpetuate those biases.
So the hope is race-based medicine,
where providers care for someone based on their race,
will soon be a thing of the past.
like saying that you have a certain disease or that you're going to develop something because you are Black or African American, or that you are from the Latinx community.
Dr. Geraldine McGee and Danielle Binion are both in the Office of DEI, Diversity, Equity, and Inclusion at KU Med Center.
The health conditions for Black and African Americans have been grave.
That's why the Repair Project and its 4 components are so important: curriculum development and revision, staff training, clinical intervention, and community accountability. As of right now, the Repair Framework is only being implemented at 2 schools in the country: UC San Francisco and now University of Kansas Medical Center. Stop me if you've never heard a medical expert say this. Blacks have a higher threshold for pain.
That is one of the most pernicious stereotypes in the history of medicine in the United States. I have had patients report that they've been told that. I've had students report that they've heard that from some of their attending physicians who are teaching them. How do we eliminate that from the classroom, not just pen to pad, but up here too? And the issue that we're really trying to deconstruct is that for years, right, the medical field has measured that there are these different health outcomes. What they were ignoring are the social and structural determinants of health. And in the United States, racism is the largest structural determinant of people's health. It outperforms class, it outperforms education, it cuts through everything. And that's something as a society that we've never wanted to confront. Even how doctors take tests for certifications and licenses are somewhat rooted in stereotypes and assumptions.
Misconception that it's only a white doctor thing, but it's not. It's ingrained in medical knowledge.
How can the Repair Project help you?
I think by sharing stories like this and letting people know that the way you're treated should be at a top equitable care, that everybody should have the same amount of care, no matter if you're Black or white.
So that doctors like Christopher Brown and Isaac Apole can continue to be aware of and mitigate all biases.
Say, building trust a lot of times when you first meet someone allows for better outcomes.
And so that women like Kim Weaver and Shalise Clay always feel valued and heard.
We should not get to a point where I rather choose losing my life than to deal with a doctor.
There has been a lot of wrongs that have happened. We can't go back and correct those wrongs, but we can correct the course to make sure those wrongs don't happen in the future. So that's why this project is important to me.
It seems like it's a long road to traverse, but it doesn't mean that it's not worth going down that road.
Well, McGee and Bingen from the Office of DEI, they're working to open a Center for African American Health, a healthcare facility specifically designed to overcome all root causes of unequal healthcare, social, economic, educational. The only other center like this in the country is in Denver. And we also want to give you some tools so you can advocate for your own health. Many of the people we talk with, they recommend bringing someone with you to be a second set of eyes and ears at your appointments. In fact, the doctors at KU Health System also provided some other tips. Don't be afraid to ask questions about anything you don't understand. If you hear jargon, ask your healthcare professionals to cut through it and speak English. Don't be afraid to ask for a second opinion. It is your body, after all. Better a second opinion than the second surgery, right? Speak up if you're not comfortable with the situation, whether you are the patient or advocating for a loved one. Do share your fears and concerns, however trivial they may seem. It may be the difference between a smooth versus a traumatic experience. And be positive, assertive, and active in your care. It really will go a long way in helping doctors care for you.